I'm going to describe for you in this video my symptoms leading up to my recent anterior cervical discectomy and fusion operation, and what to expect during the surgery and what my expectations are for the future. I'm 8 days post-surgery and feeling quite good, and I hope this video can answer some of the questions you might have if you're faced with the same decision to have surgery as I was. My story begins about 8 months ago when I developed numbness in my left hand, and I also started to get some pains in my neck and pins and needle effect down my arms and in my neck, primarily when I turned my head to one side when I was shaving or doing anything like that else. The symptoms eventually got worse to the point where it affected the functionality in primarily my left hand, where I couldn't do things as easily. I had difficulty buttoning buttons on a shirt. I couldn't move my fingers like I used to. On the right hand, for instance, still I can move this finger quite easily, but if I try and do it as fast as I can, this is all I can accomplish with the left. I also started to get muscle weakness and a little buckling in my knees, and at least one case I think I can attribute to this of having fallen. In any event, I saw an orthopedic physician starting about 8 months ago, and after a series of diagnostic tests which involved an EMG and which involves looking at the function of your nerves in your arms, they were able to rule out such things as carpal tunnel syndrome. And after having an MRI, they clearly was able to see that I had cervical stenosis, in other words, a narrowing that was pinching my spinal cord in two places, at what's called the cervical C4-5 junction and the C5-6 junction. And after several months of conservative therapies ranging from exercises, physical therapy, oral medications such as prednisone, epidural injections in my neck, nothing worked very well. I spent several weeks having about a half an hour a day of neck traction that felt good but didn't really have any lasting impact on the symptoms. It was finally decided to consult a surgeon. In my orthopedic doctor's practice, there was a doctor that did nothing but orthopedic spinal surgery. I consulted him. He was very impressive, spent a lot of time with me, explained that what I needed was called an anterior cervical discectomy and fusion, where they would remove the degenerated disc material in the two discs and replace that with either grafted bone from my hip or from a donor or from a mixture inserted into a cage of my own bone material removed during surgery, etc. They elected to go with the third approach, and long story short was I prepared for my surgery. Importantly, I did have a second opinion. I saw a neurosurgeon who agreed I needed exactly the same operation, and so that made me more comfortable with doing it. Got ready for surgery by having a pre-op physical with my own internist, who did an EKG and various kinds of blood tests to make sure I'd be okay during the surgery. And was also told not to take any aspirin or NSAIDs such as Advil for 2 weeks prior to the surgery, and we went and did it. The operation lasted 6 hours. It's not a hugely invasive procedure, but it is delicate and time-consuming. And I woke up in recovery with very little pain, and what pain there was controlled. They gave me a pain medication pump where I pressed a button whenever I wanted a little bit of medication. I stopped using that after 24 hours and switched to oral medications for pain, and I stopped that after about 3 days. Never really in a great deal of pain. The biggest irritation was the fact that you wake up with your voice is hoarse or husky, some people more than others, and your throat is a little sore, primarily because they put a breathing tube down your throat during the operation, and that's somewhat irritating. I'm still dealing with that condition, but it's slowly improving, and I'm not concerned about it. And my voice is pretty much back to normal. After 2 days in the hospital, I was released, and as I said, it's now 8 days post-surgery. I am pretty much back to normal in terms of my energy level. I saw the doctor yesterday who removed the bandages, and I was doing quite well. He allows me to stop sleeping in the neck brace, which they fit you with prior to going into surgery and tell you to bring this with you to the hospital. It looks like a medieval torture device, but it's actually fairly comfortable. You waken up in the recovery room with this or a similar device on your neck to provide stability and to provide support for the neck muscles, which during the procedure are stretched because the replacement material that goes in the space where your discs were is actually larger than what they remove. In my case, my discs were compressed to 1 to 2 millimeters. They need to be restored, or that gap needed to be restored to 7 millimeters. That's a 5 millimeter increase for 2 discs, or a total of 10 millimeters, which is about 1/3 of an inch. And that's a significant enough burden on your neck muscles that they are a little bit sore after surgery. So your neck is a little bit sore, your throat is a little bit sore, the incision is not sore. I've never had any pain from the incision itself. So the post-surgical experience has been actually pretty good. He says I can start driving again. I can start reducing the wearing time of that neck brace. I don't have to wear it at night anymore. And so I'm on the road to recovery. He took x-rays to make sure nothing has moved yesterday and everything's fine. And I see him again in 3 weeks. At that point, he can judge whether the fusion has been complete. And if so, then I'll be starting physical therapy for some period of weeks to strengthen my neck and get 100% back to normal. So that's my experience. It's been a pretty positive one. Oh, certain of the symptoms actually went away almost immediately after the surgery. The weakness in my arms and legs is gone. I had a little difficulty with balance and with stability. That seems to be gone. The numbness in my hands will take longer to recover, up to about 6 months, though I'm sure that will come back nicely as well. So I'm looking forward to a complete recovery from all my symptoms, and I hope this information has been helpful for you.